morning, everyone, and welcome to the April edition of Add Water and Stir. As promised, today's topic is going to be mitigating patient complaints and potential poor outcomes, correct?
Mostly about side effects.
Mostly about side effects.
Yeah. Yeah, that's what I want to talk about. Part of our training, or a big part of our training, is to mentor new practitioners in all of the steps of performing proper and standard of care dental sleep medicine. And there's a lot that goes into it. It's not just doing a bite registration and delivering some kind of device. The American Academy of Dental Sleep Medicine, the guidelines are to have regular follow-ups. It's very important that we work closely with our patients so that they can have successful outcomes. There also are some side effects that occur with any type of therapy. We know about side effects with CPAP. We've talked about that a lot. But there are also side effects with oral appliance therapy. The good news is that these side effects they're not complications, and they're relatively minor when you think about it. But there is one side effect that I want to talk about today, because I would say that that side effect is probably the most vexing side effect for new novice practitioners. Okay, so what are the most common side effects that give us the biggest complaints from patients? Well, one is unwanted tooth movement. Okay, well, certainly that can be eliminated if one is very careful to create excellent records. And when I'm talking about records, I'm talking about impressions and bite registrations. Nowadays, with digital impressioning, accurate, perfect impressions are virtually always possible. The other advantage, of course, is it gives you unlimited storage, and you can then electronically transmit your impressions along with the bite registration to the laboratories that will manufacture high-end appliances. And I stress high-end appliances. Some of the quote-unquote less expensive tester-type appliances, they don't hold up well. They will result in unwanted tooth movement because they don't capture and rigidly hold the teeth properly. So stick with a high-end rigid appliance. I'm partial to acrylics and polymethyl methacrylate materials. So unwanted tooth movement, we kind of talked about that, so let's talk about the other one, the one that really stops a lot of practitioners cold, and that would be jaw pain. Okay, so when does the jaw pain occur? Well, typically it will be occurring in the morning. One takes out their device, and the complaint is that my jaw feels sore when I try to get my back teeth, and my back teeth don't go together. And if I really try to get them together, it's painful. That is the complaint.
Okay.
So I need to put my coffee cup down because I'm going to need to use two hands. All right, so let's think about what these appliances are doing. Well, okay, you're putting in an appliance that's protruding the mandible forward. Okay, well, what are the muscles that protrude the mandible? Well, there are three main muscles. There's the lateral pterygoid, the medial pterygoid, and the posterior digastric muscles. But the most affected muscle is the lateral pterygoid. And the lateral pterygoid, as you know, connects to the to the ascending ramus along the neck of the condyle in that area, and that's a small muscle that then will protrude the jaw forward, and it's a weak muscle. And you can try it yourself. I mean, it's easy to overcome the strength of that muscle. So it's shortened all night long. Okay, think about that. This muscle is shortened, and now you take this device out, and it has to stretch back half a centimeter or more, sometimes up to a full centimeter, and you get ligament strain. Okay, and the ligament strain can result in trigger point development within that lateral pterygoid. Now, trigger points in muscles then spread to the rest of the functional group of muscles. And the rest of the functional group of muscles are all the muscles that are involved in chewing, in mastication. And so what we'll see is that the patient will come in and they'll be maybe complaining of ear pain, sinus pain, jaw pain. But the reality is that it's trigger point pain that is now affecting other muscles, and it is all muscle. So number one is you have to tell your patient at delivery that this is a likely occurrence, okay? Even though it doesn't occur very often, maybe 10 to 20% of patients who get these will have any complaint at all of soreness, and very few, maybe 1 in 20 or less, will really complain about it. But I tell all patients that this is a likely scenario. It's not uncommon. I explain to them what's going on with the muscles. Once they understand it, that helps them a lot. Other things we talk to them about is that, it's okay if you, particularly in early going, if you wake up and it feels sore and you're going to take, we like Advil or other non-steroidal anti-inflammatories, if that's appropriate for our patient, we'll certainly have them take that. But the most important thing is to stretch the muscle back to its normal length. And we do that with a variety of modalities, okay? So there's a morning repositioner, and they're bite wafers, and they come in various flavors. One that I like a lot is rigid, and it's shaped like the arch. You heat it up in a water bath. You have your patient bite down and squeeze real hard all the way together, all their teeth together, and then you bend down the front tab, let it harden, and that way when they bite down, it does push their jaw back. The limitation there is that they only get to centric relation, okay, to the centric bite, excuse me. We want that muscle to stretch even further than that, and that's where jaw stretching exercises come in. And it's kind of counterintuitive, okay? You think of stretching, when you think of stretching with the jaw, it's actually pushing back on the jaw to stretch back the lateral pterygoid muscle. And it's critical that patients do these every single morning, regain their bite. Also flexing movement exercises left to right, that will help as well. We don't recommend adjusting titration backwards in most cases because you lose all the therapeutic benefits of your appliance. One thing we will recommend if the person's really having a significant episode is just take a holiday for a day or two and then put the device back in. Another thing that you should be doing is making sure that your patients have access to you over the telephone, because this does not have to disrupt your day with a patient who has this sort of complaint. Most of the time, you can handle this over the phone, just like I'm doing, or have a Zoom meeting and go over this directly with your patient. So they don't necessarily have to make a visit back into your office as a quote-unquote emergencies, because one of the nice things about dental sleep medicine, there are no emergencies. No, there really are no emergencies. If it's really bothering you, take it out, take a break, go through some home physical therapy. One thing that our clients do get is a handout that they can give to their patients that I've developed called Home Physical Therapy. And you can transfer it onto your own letterhead if you're a client, and hand that out to your patients as well. And what that talks about is using soft diet, non-steroidal anti-inflammatories, alternating hot and cold compresses to increase circulation, and stretching exercises, and then proper oral posture during the day, so that to mitigate and to eliminate some of the daytime clenching that may go on. So I think that kind of goes through it in a nutshell. What else can we talk about today, Nicole?
If a patient came in with a history of TMJ issues, would that be a eliminating factor, or is that something that a provider could work with to get the patient sleep apnea care?
Okay, that is a great question. So you've got a patient who comes in, and and part of our examination is a screening. And they say, yeah, I had a history, or I do get jaw pain, jaw soreness, etc. Well, you need to do an evaluation, and you need to get a diagnosis as to what is actually going on. And there's two things that could be going on. There's either some sort of what we call intracapsular derangement, where the disc is displaced. It may or may not be reducing. That's when, if it reduces, you'll hear a click and a pop, and then normal opening range will occur. If it is non-reducing, then the patient can't open beyond beyond 2-finger width when they open their mouth, or they'll deviate to one side or another. You need to evaluate for that. Number 2 is you need to palpate the muscles. I got to tell you that 99% of the time it's all muscle. So the same thing applies when it comes to advising your patients. You need to educate them as to what's going on, how to mitigate that. Home physical therapy is very effective for them. And also, an oral appliance can actually be therapeutic, because a lot of the time this muscle pain is a result of parafunction, okay, clenching, grinding their teeth. We know that jaw pain, muscle pain, clenching and grinding and sleep apnea are cousins. So we eliminate the sleep apnea, a lot of that goes away. Yep. Designing your appliance properly so that we eliminate that kind of loading and stress. And also just being able to have the jaw in a little bit open, in a little more of a forward posture, and having that freedom, and not having what we call a so-called trapped mandible, that helps as well. Is there any evidence that wearing an oral appliance is going to make a pre-existing condition worse? No, there is not.
That's some good information. I think that's something that a lot of people are concerned about.
And you have to keep in mind that the insurance companies, if you're billing medical insurance, are looking for a way to deny coverage. And one of the things that they've come up with lately in the last few years, which is complete BS, is that if there is any kind of pre-existing TMJ condition, the oral appliance is not covered. I think maybe that cropped up because of inexperienced practitioners or untrained dentists providing oral appliance therapy without the proper coaching of their patients and understanding of what to do. That may be part of it, but suffice it to say that you've got to be careful about your documentation and all that. And if you do have a patient that's got some mild muscle tenderness, talk about it with the patient. But I would check off within normal limits on your examination form, and then Blue Shield in California now returns a checklist questionnaire that we have to check off, and part of that asks about TMJ or TMD, and you check it off accordingly. So that's what you need to do. So the answer is oral appliances can help with existing TMJ conditions. You need to coach your patients properly, and you need to construct well-fitting and properly titrated devices.
Makes sense.
Yeah. So,
all right.
Well, how about next time? What are we going to do?
How about next time we go through doing a webinar for patients? I know we've talked several times, mentioned community talks. I know that's maybe not something that is doable at the moment, but we have been saying that that's something that translates nicely onto web conferences. How about how to set up, market, and do a sleep apnea 101 presentation via Zoom?
That's a great idea. In fact,
potential new patients.
Great idea. I have one on the books to do on April 20th.
It's almost as if I knew.
5:30 Pacific. Anybody who's on is invited to register. How do you register? Well, go to my website, drgreenman.com, drgreenman.com. Probably by early next week, there will be a link that will allow you to register, and you can certainly hear how we do it. And then we'll talk about how to construct something like that at our next Add Water and Stir.
Yes. All right. So anyone on watching live or watching later, how do you get a hold of us if you want to ask questions, know more, get some nice insider information? You can call us at 818-561-6715. You can email us at info@dentalsleepapneatraining.com. You can find us online at dentalsleepapneatraining.com. We have a big button right at the top of the page if you want to set up a little time to talk with one of us, both of us live. Please, 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 we encourage you to sign up. We love to chit chat. And then you can find us on Instagram at DSM Solutions CA or on Facebook at DSM Solutions. We will talk to you next month. Bye.